For those of you keeping score at home, we've gotten our second question via Facebook, and this one is from Cassandra. A nurse in my daughter's school called me a few days ago and said that she noticed her leaning to one side, my daughter, I assume Cassandra, when she was walking down the hall recently. The nurse suggested that I get my 12-year-old tested for scoliosis. I guess my question is this: how does scoliosis get diagnosed? Cassandra, that's a great question. Thank you for sharing with us. So there are a number of ways how a doc may be able to diagnose scoliosis. There's something called the Adams forward bend test. Essentially, if you stand perfectly square behind your kiddo or in front of your kiddo and you have them throw their hair forward so that it doesn't obscure your view, you ask them to put their hands together and sort of lean straight down with their feet square against yours. In someone without scoliosis, as they lean forwards, you'll see that their thorax is totally even, like two equal hills that meet right in the middle where the spine is. But in someone with scoliosis, because of the rotational element, you'll see that the hills are no longer symmetrical. And that is a positive Adams test. Now, keep in mind that there's quite a bit of a margin of error, probably no less than 10 degrees. Don't panic if that happens. You can live your entire life with scoliosis. Please don't let that scare you and make you catastrophize. If you see a curve, a doc may also use something called a scoliometer, which is essentially just an industrial level that's fitted with a round kind of convex bottom that allows you to lean it onto the back, and then you could see a little air ball will move to one side or the other side if there is asymmetry. Physicians can also use a CT scan and MRI to diagnose scoliosis, and of course, X-rays are probably used most often. When we obtain these X-rays, we use something called the Cobb method, C-O-B-B, where we draw some horizontals at the most asymmetrical vertebra and then align those to figure out the angle between the vertebra. And again, even with that, there's at least a 5-degree margin of error.